Before watching this video, I would like you to watch the previous videos on binocular balancing series for a more clear understanding of the basics. I have linked them down in the description. In this video, we will learn about the Humphriss immediate contrast method of binocular balancing. This technique was first suggested by Humphriss in 1988. Principle: the technique uses a fogging lens in front of the non-tested eye to relax accommodation, but also uses the effect of binocular summation and inhibition of visual acuity to determine the appropriate lens to add to the tested eye. It is not a true binocular balancing technique, as here we do not compare images from the two eyes, and accommodative balance is assumed because the best vision speed assessment is made in a binocular situation with accommodation relaxed in both eyes due to fogging lenses. Fogging of one eye by a small amount, typically 0.75 to 1 diopter, has many benefits in that it relaxes accommodation and suppresses central vision while maintaining the peripheral vision. The dissociation is therefore minimal and various factors like pupil size and muscular balance remain in the normal binocular state, unlike during monocular refraction. Procedure: first, we are going to test the right eye. Fog the left eye until the visual acuity is reduced by 3 or 4 lines less than the tested eye. Young patients with normal visual acuity would usually require adding plus 0.75 to plus 1 diopter to give a visual acuity of 6.9 to 6.12. Ask the patient to look at the smallest line they can see on the letter chart. Place a plus 0.5 diopter lens in front of the right eye for about 1 second or longer if the patient appears to need more time. And then replace this with a minus 0.5 diopter lens for about 0.5 seconds or half the time given to the plus 0.5 diopter lens. So, why do we only hold the minus 0.5 diopter lens for half a second in this method? Because the patient will start to accommodate if the minus lens is left in place for too long. Now, ask the patient, are the letters clearer with lens 1 or lens 2? The image seen with each lens is determined by the clarity of the image in the clearer eye, modified by the effects of binocular summation. Responses: if the patient immediately reports that minus 0.5 diopter is definitely clearer, repeat the demonstration of the lenses and ask if the minus 0.5 diopter is definitely clearer or just smaller and blacker. Only add minus 0.5 diopter if the patient immediately reports that the lens is definitely clearer. If the patient reports after some consideration that minus 0.5 diopter is clearer, do not add it, as they may be accommodating. If the patient reports that the plus 0.5 diopter is clearer or that there is no difference, in both the situation, add plus 0.5 diopter to the refractive correction. A plus lens that relax accommodation or a minus lens that make vision clearer should both be more comfortable to the patient. In the other case, a plus lens that blur vision or a minus lens that makes eye accommodate should be less comfortable to the patient. Now, because you have added plus 0.5 to the right eye, it is assumed that accommodation will have been relaxed in both eyes. To ensure that the amount of fogging lens is still effective, add plus 0.5 diopter to the left eye. Continue to compare the minus 0.5 diopter and plus 0.5 diopter until the plus 0.25 is immediately rejected. Repeat the procedure on the left eye with the right eye fogged. Most common errors: presenting the plus 0.25 and minus 0.25 for an equal amount of time. Failure to modify the fogging lens when a change to the sphere of the fellow eye has been made. Overfogging an eye, example with a plus 2 diopter, may cause the eye to become monocular. I hope you found this useful. Thanks for watching. Subscribe to Let's Learn Optometry for more optometry and eye care videos.